These are some weird things that we do to ICU patients that if you don't work in healthcare, you're probably going to find very, very interesting. The first thing is a full head to toe skin check. And I mean head to toe. Whenever we get a new admission, we will ask if we can remove your clothes, remove your gown, and literally do a full body skin check to see if there are any pre-existing wounds or things that we should be concerned about. Of course, you always have the right to refuse this, but we definitely want to get a baseline assessment, and we even take it a step further and we do this every single shift. Every 12 hours, you are getting a head to toe skin and everything check. And if you do have any existing wounds, we are going to document them right when you come into the hospital. Most labs and scheduled scans in the ICU are at like 4 o'clock in the morning. And that is so everything can get done, labs can get drawn, x-rays can get taken, and everything can be back, like the results can be back. So that way when the providers come in during the day, they can review them. Most patients in the ICU are getting their blood sugar checked every couple of hours, typically every 4 to 6 hours, sometimes more often depending on their blood sugars, if they are a known diabetic, if they are on an insulin drip. But even if they are not a diabetic, we typically check patients' blood sugars pretty regularly in the ICU, because whenever somebody's sick, their blood sugars can get really out of whack, and we want to make sure that we are either keeping them within range and bringing them down if they're too high, or giving them enough dextrose, enough glucose if their sugar is too low. If you are on a ventilator, we will be brushing your teeth at least every 2 to 4 hours. This is to prevent all of that yucky bacteria that grows in your mouth from going from your mouth down into your lungs and helps prevent pneumonia. If you're unable to move or reposition yourself, somebody will help you reposition yourself at least every 2 hours. This is to prevent bed sores and pressure ulcers and just from you getting any sort of skin breakdown. ICU patients also get a bath every single day, and if you are on a ventilator or have a central line, then we will typically do a chlorhexidine bath, which is a type of antibacterial wash to reduce the amount of bacterial growth on your skin, to reduce the chance of you getting some sort of secondary infection while you're in the hospital. Okay, those are just a few of the interesting things that we do to ICU patients, but let me know if you have any other ones that I can add, and maybe I'll do a part 2.